All right. Good morning and welcome. I'm calling this meeting to order. Welcome to our May PEB Board Meeting. Our meetings this year will continue to be hybrid. It's red. Good. Testing. Okay. The Healthcare Authority staff will be on site, and board members and other attendees have the option of attending on site or via Zoom. Although we love seeing you all in person, so thank you for joining us here in Olympia. For our Zoom attendees, our opening slide has information about how attendees can turn on closed captioning subtitles. And I'd like to begin by doing a roll call to identify the board members with us today. Michaela Dolman. Present. Thank you. Elliot Weinstein. Present. Harry Bossy.
Present.
John Comerford.
Present.
Thank you, John. Tom McRobert, I believe, will be joining us in about 30 minutes. And staff, please call that to my attention so we can note that in minutes. Kurt Spiegel.
Present.
Thank you, Kurt. I see you're on virtually. And then Sharon Lang, thank you.
Present.
Great. And Sharon, it's fabulous that you came down to be with us in person. Also, Michael Tunick from the Attorney General's office.
Present.
Thank you. And I'm Sue Birch, the agency director and the board chair. Just a few reminders, with board members attending both in person and virtually, it would be helpful for the board to hold their questions until each presentation is done, or when the presenter pauses and asks if there are questions. Board members attending virtually will also be watching in case you use your Zoom's raise your hand feature to indicate you have a question. We do have a couple of resolutions scheduled for action at today's meetings, so the public will have an opportunity to provide comments specifically on each resolution during the normal procedure before the board takes a vote. The public will also be able to provide general comments at the end of the meeting during our public comment period. As a reminder, if the public has questions during a staff presentation, the presenter's contact information is included at the end of their presentation, and the public is welcome to email presenters during the meeting to capture your question for a response after the meeting. Now, we are, we're monitoring virtual hybrid meetings, so it's a little tricky at times. So if, for example, board members, we don't see your hand or don't catch it, we continue to roll on, please do not be bashful and chime in verbally, but we will try to be attentive. I want to just let everybody know today that we have both Jean and Dave. Dave is on virtually. He's been rather under the weather, and I encouraged him to stay home. So Dave, if you have coughing fits and or need to pause out, both Jean and I stand at the ready to take on your part. So please don't overdo it, okay? We're worried about your health and wellness. But Dave, I will go ahead and let you provide an overview of today's agenda, and I know you're going to signal us if you fatigue.
All right. Good morning, Chair Birch, members of the board. I was just thinking about the fact that during the entirety of the pandemic, I was one of the few people that came on site for every board meeting. And here we are. This is the first board meeting I think oh no, it's the second. It's the second board meeting I've attended virtually. But as Sue said, I just didn't think it was, well, she and I talked, and it's just really, my coughing fits right now could be quite distracting, and no one wants what I have right now. So some nasty stuff going around for people, and I don't want to contribute to the spread of it. So I appreciate your grace, and I will turn my camera on and off as needed. The other collateral benefit is I will interject less, because the more I speak, the more I cough. So you might see me jump in a little less this meeting. So today we have for you the approval of the April minutes. As Chair Birch said, there are 2 votes on the UMP benefit design that Ryan Ramsdell is bringing back related to breast exam coverage and the diabetes management program. And then we, throughout the season, I have given at the beginning of the meeting a little bit of an update on how the launch of Benefits 24/7 has been going since the mid-January launch. But we have Chatrina Pitch here, who is from our IT area and manager over that project, among many other projects at the agency, to give an update from her perspective and a little bit more comprehensive update on the launch of that system. And then we're going to talk about something that hasn't been talked about in the board for a really long time, possibly decades, which is auto insurance. It is another benefit that sits in the employee side of the portfolio that has a longstanding contract with Liberty Mutual. And we wanted to talk about the nature of that contract, that type of benefit. And, you know, there's the potential in the future for other collateral benefits in the portfolio beyond medical, dental, vision, life insurance, and disability. And so we want to start talking about kind of criteria that could be used to evaluate benefits that are collateral to the core, the things that people classically core think are part of the PEB program. So we wanted to remind people about this benefit, talk about some of the pain points that have existed over the years, and talk about the criteria for evaluating benefits in the future. The public meeting is relatively short. We'll then go into an extensive executive session where we begin the conversation with you about the proprietary information that's at the start of the Medicare rates for the portfolio. We get more information and initial bid rates for the non-Medicare portfolio later this week. So today our executive session will be primarily about the Medicare portfolio. As a reminder, if there's an emergency, head across the street to the visitor parking lot. If you need the restroom, head towards down the hall. And when you see the elevators, look left. I'll monitor an emergency from afar. And with that, I will give it back to Chair Birch.
And the nurse in me just loves that you were able to get through all that without triggering a bronchospasm. So I see that advice of stay home and keep drinking fluids, Dave. Good. All right.
Cough drops are really helpful.
Good. All right, I'd like to move us on to our first action item. This is the approval of the meeting minutes. We're going to be voting on the meeting minutes from our last board meeting on April 11th, and they are behind your tab number 3. Are there comments from the board about the meeting minutes? If not, do I have a motion to approve the minutes as written?
So moved.
Thank you. Is there a second?
Second.
Thank you. And all those in favor say aye.
Aye. Aye.
Are there any opposed? Okay, the April 11th, 2024 minutes are approved as written. All right, we are going to move on to our second item, which is the UMP benefit design. Our very own Ryan Ramstall is our team manager in the Employee and Retirees Benefits Division, and he's going to be bringing a couple of resolutions to us today regarding UMP benefit design changes for 2025. His materials are behind tab 4. There are 8 slides there, and Ryan, good morning. Welcome.
Chair Birch, members of the board. My name is Ryan Ramsdell. I am the UMP TPA team account manager. And we're going to walk through a couple of designs that I brought to you back in.
Thank you, Butler. Are you on?
Can you hear me?
I didn't know if the recording was picking up.
All right, I'll speak louder. So I'm going to bring 2 benefit designs to you that were proposed back in April for your consideration. One of them is around supplemental and diagnostic breast examinations, and the other one is around a diabetes management program, the vendor known as Omada. So as relates to the first proposed resolution, there were no concerns regarding that particular proposal. I do need to call out, however, that there was a revision to that resolution, minor revision. Next slide. So we have removed the 4 in-network services from that proposal. We confirmed that with our third-party administrator, and it does include in and out of network for this particular benefit. If there are no questions from the board, then I will turn this resolution over to Chair Birch. Next slide.
All right. So I'm going to now ask for a motion to adopt.
So moved.
Thank you, Elliot. And is there a second?
Second.
Jonah, you're not technically a voting member, John?
No, but some result that I can make motions and second.
Okay, so John Comerford, thank you for that clarification, reminder. I'm going to see if there is any public comment on the resolution at this time. So I'm looking at Mackenzie. Can we see if there are any signals from our virtual public audience? I don't see anyone here in the room with comments. Nothing online. Is there further discussion from the board?
Yes, it's Harry. I'm fine with the resolution. And I guess I want to make sure that Regents, whoever is fine with this, because the out of network is the part that I would be not questioning, but wanting to make sure that we're tied in. I wouldn't want somebody to go to an out of network and then go through the whole rigmarole of convincing Regents or whoever the administrator is to pay the additional cost. So it's not brought back to the member at some point, or that I don't know how we avoid plan if it's able to avoid the provider charging whatever they want, beyond our normal standards. That's all. Thank you, sir.
Any other comments before we do a roll call vote?
Just a quick question. I also agree with this. Is there any like gender restrictions on this or?
I'm not familiar with it being gender restricted.
Other questions, comments? All right, we're gonna go forward with the roll call vote. Michaela?
Aye.
Elliot?
Aye.
Harry?
Aye.
Tom, we don't have yet. Okay, Kurt Spiegel?
Yes.
Thank you. Sharon?
Aye.
And this is Sue Birch. I vote in the affirmative. So the resolution 2024-23 passes. And Dave and Michael, I just am remiss that I did not restate the resolution. Should I, for the record, read that in? I know I'm a little off the order, but anybody?
I think that, I guess it would be helpful to have it, I guess, in the record, but I don't think that it's necessary just because, yeah, like it's the PEB resolution is there. And it's been read before, but yeah, I think.
Thank you. I will get the order correct next time, but that was in regards to resolution PEB 2024-23, the UMP diagnostic and supplemental breast exam coverage, which was displayed on screen and in writing. So I think we're clear about that. All right. Ryan, can you move us into the second resolution, please?
Certainly, next slide. So as it relates to the diabetes management program, there were a couple of follow-up questions that I wanted to get back to the board on. One recommendation was, although it was covered, just a very brief reminder or overview on what the diabetes management program is. And I want to remind everyone that we also have a diabetes prevention program. So these are individuals that have not at this point been diagnosed with diabetes, but it is the same vendor and it is a similar process. This is an online tool, application, so forth. And in most cases, it comes with a digital scale. So that links into that application. A lot of this is lifestyle modification, which is pretty standard. The program itself includes a scale. There's components around meal tracking, activity tracking. There are human guidance components, health coaches, and they also try to tie you into a peer group. So you can engage in that way, ask questions, figure out tips and tricks and so forth. And then there are any number of interactive lessons that go on within this program. We have been doing this in SEP for a year now. So we are trying to establish parity by bringing it into the PEB portfolio. So any questions on that part? And then I'm going to move into a question around dietary coaching.
So this does not include enrollees who are in Medicare?
That's correct.
Do we have a similar program? Or?
I'd have to get back to you on that in terms of the relationship to that is that typically most of our vendors contracts in this realm don't have contracts with Medicare. So this is a opposition between UMP and Regions and their vendor.
And would the enrollee have to take health insurance through HCA, or could they have, for instance, spousal health insurance?
This one is explicit to the UMP members. It's also offered in some of our,
okay.
yeah. I think Kaiser also proposes to offer this or does offer this as well.
And I know it's early, but it's probably not data available, but to your knowledge, it's SEB or we at some point get some kind of feedback from Obata on what they've been able to do or membership has been able to accomplish, or, some feedback on the effectiveness?
Sure, we get reporting. That's one of the jobs as a manager of the unit. So we can bring back some outcomes and or engagement reporting to you. Give me a little time on that and bring it back to the board.
Other questions? All right.
Maybe we'll move here into dietary coaching component. And I'm going to use some of Omada's words directly just so that I don't misquote, but we did reach out through Regents to find out questions regarding their approach to culturally relevant foods and et cetera. So it's a little long, but I'll try to summarize a little bit more. But Omada's program experience is personalized for each unique member's needs, including food choices and being culturally sensitive to these unique needs. So as far as diet, we start with the recommendation of Mediterranean diet and follow the guidelines within DSMES nutrition. That's the diabetes self-management education and support. It's fairly well known within the industry. Then they further personalize through the following pillars. So they ensure that their care team is made aware of culturally sensitive and are culturally sensitive in terms of coaches and specialists who are trained on the topic of health equity and social drivers of health. Our care team is educated on the role of institutional racism and implicit bias. Second, we engage members with contextually relevant program experiences. We leverage data to understand disparities and use social drivers of health as factors that inform aspects of our product platform development. And we create commitment with members by addressing their unique needs with relevant clinical guidelines. I know a lot of that is filled with jargon, but I want to make sure that I provide you with their response. So the last part to this is that one of the ways that they try to address barriers within social determinants of health topics, access to healthcare. So members are assisted on how to navigate barriers that impact their access to healthcare services. For example, a member's ability to communicate to a doctor's appointment is impacted. Their coach is able to identify transportation resources for the member to help them get to a doctor's appointment. Food insecurity, members are supported in addressing food insecurity while also eating healthy, sufficient meals. Coaches are equipped to refer members to food access programs. And then built-in environment and safety, members receive reinforcement to have a safe environment. Coaches recommend specific interventions and resources for members to be able to live, eat, sleep, exercise in their lives and in a safe environment. And then in Q3 of 2023, Omada launched accelerated barrier recovery. So part of each member's pre-program experience, this feature allows Omada's care team to be aware of unique barriers for each member, i.e. trouble accessing affordable foods. Data shows that 72% of members who started barrier-related activity during a pre-program launch completed. So that was some of their feedback around their approach to diet coaching as well as larger aspects of social determinants of health. Does that help with the question? Okay.
Sharon?
I do have a couple of questions. So a lot of these coaching apps have had, there's some barriers for lower resource communities accessing it because they have a time navigating not only the device, although there's all that up to think about how that is, how that engages a lot of these clients. The issue is around not only understanding the information, but being able to track the results and understanding what your results mean. And so we've had up to 84% of patients reporting not really understanding how to navigate. I think that I'm really quite interested in the question that was asked here in terms of assessing how it's working for patients, simply because many of these tools are not tested on certain demographics.
Sure.
It's not tested on certain demographics. People have a tough time using it because they have not been tested on it. And so I'm really, and frankly, the reason I'm concerned about this is that there are certain groups that are more likely to be impacted by chronic diseases. So we want to make sure that they're involved in the clinical testing of these tools to ensure that they're able to understand it in terms of not only inputting their data, but in monitoring and understanding what it means. So I think that follow-up assessment is how people are doing, but certainly by demographic, we have specific information in terms of how various demographics have fared, not only in terms of tracking the results, inputting their data, certainly understanding what it means. That is going to be very key to ensure that this is really useful for a broad sector of our
Thank you for that, Sharon. Ryan, we can also involve our Dr. Quinn Wynn, our equity director, in kind of as the analysis comes in, and I'm sure Heather, our CMO, will be very involved as well. So we can look at things with that equity lens a little more granularly, and I'll be certain to mention that in our future. I think, Elliot, you had a question?
Actually, I'm following up on what Sharon said. Sometimes there are surveys where you can hear from the participants what the problems were, but sometimes certain demographic groups don't respond to written mailed surveys as well. And I'm not an expert on how to deal with that, but it is something that I think your group needs to look at too. I'm done.
Carrie?
Yeah, thank you. I think what most of us are saying, how important is communication on this. And I guess we can learn from SEB's history with this, because, at some point in time, people need to know, how do I get enrolled? Do I have to? Certainly, it's going to be lab testing involved. I have to pay for that. There's going to be a referral to a specialist, and that could be a cost share and those kinds of things. I don't want to get into little weeds now, but those are the kinds of things that we need to make sure people understand as best we can during that education process. Thank you.
I can say that I think it's fairly easy to enroll in this program. It has a basic survey. So once you're directed to it, it'll ask you a series of questions. And I think some of it is sort of trust-based. I don't know that it's hyper-invasive in any way. So that gets you through the door. And then from there, the program begins to sort of assess your needs.
Yeah, and Ryan, I would just add that Department of Health is a huge partner in diabetes management efforts. And so WMATA is something that has been happening for quite some time. And certainly we have the pre-run with SEB, but we work with our Department of Health providers because if there is a disease management group that is really we're on top of, it is this one. And that's not to say that we can't do better with the equity lens and whatnot, but I just want to assure you that this is beyond HCA and beyond her Department of Health is very involved. This is a group that is very highly sought, courted, followed. We constantly tweak with that equity perspective of what more we can do. Yeah, go ahead.
And there's a language component that's built in.
There is.
Okay.
Elliot?
And I guess for me as an older person, and I'm guessing other groups, you really need a number to call because sometimes, and I guess my thing is the tech, if I don't have somebody to say, what does that word mean? I'm lost. So I think as long as, and I worked for Department of Health, so I know they're not perfect. They need to have a number to call, somebody who can relate to the caller and explain what some of these terms mean. Thank you.
All great input, and I'm sure that Ryan will be back to us with our team about the successes and the monitoring of the program. All right. I think, Ryan, do you have anything else, or can I move us forward with the resolution?
Certainly.
Okay, so we are at this moment going to go into a vote. This is Resolution PEB 2024-24, the UMP Diabetes Management Program. Resolved that beginning January 1, 2025, the Uniform Medical Plan, or UMP, will implement a diabetes management program. Is there a motion to adopt?
Moved.
Second.
Okay, thank you, John. Thank you, Elliot. Are there any comments now from the audience? Not seeing any here in the room. Mackenzie, nothing online. Are there any further comments or discussion from the board? All right, again, we're going to do a roll call vote. Michaela. Aye. Thank you. Elliot.
Aye.
Thank you. Harry.
Aye.
Thank you. Kurt Spiegel.
Yes.
Thank you. Sharon.
Aye.
Thank you. And this is Sue Birch voting aye as well. The resolution 2024-24 passes. All right, Ryan, I think you have a few final comments to share.
Yeah, next slide. So of course, once we move into open enrollment, we'll be updating member-facing materials, access for them to be able to use this service. We'll be updating Regents so they can deal with member communications and prepare for implementation. And then we'll make sure that we do all the things we have to do in the background around Regents' internal systems and updates. That is my presentation.
Thank you very much. And it's exciting that we are advancing on this. All right. And again, for members of the audience, Ryan's information is there. If there's any questions that you have, you can direct those to Ryan. I'd like to move us, we're ahead of schedule. I'd like to move us into benefits 24/7 update, and Katrina is online with us. So her materials are behind tab 5. And I remind you that Katrina is our IT policy and planning manager in our enterprise technology services division. And she's going to be presenting some information on how things are going with the benefits 24/7 launch that was undertaken earlier this year.
Thank you, Chair Birch. Good
Yes.
morning, members of the board. Thank you for having me today. Happy to share progress that we've made in launching benefits 24/7. You can go to the next slide, please. So we did launch in January on the 16th, and this application replaced both PEB My account and SEB My account, and also some access for benefit administrators that were previously using portions of Pay 1 for reporting benefit eligibility and enrollment. So a few of the improvements that we've made for the PEB organizations, certainly the ability for members to make newly eligible elections, to be able to submit dependent verification and have that processed within the system, resolve dual enrollment in real time by having a shared database that includes both the SEB and PEB population, the ability for a retiree to apply for, initiate their retiree enrollment, and then additionally special open enrollments. Also have the opportunity now for benefit administrators to see subscriber enrollment history and actions taken within the application. Next slide, please. So we have certainly had many successes with the launch of the application. However, we've also had some challenges. We are working through some reported issues, some data inconsistencies related to our data migration. We had 40-year-old data in some cases that we ported over from Pay 1. And we've resolved a good number of issues. Some of them, for example, are a benefit administrator's ability to prospectively terminate an employee. We had Social Security numbers now that are eligible that start with a 7 or an 8. That was a change with the Social Security Administration that they now have those SSNs being issued. And so we needed to update our database to allow for those. We also fixed some enrollment issues, enrollment dates for newborns, and then also resolved a lot of issues that we had around some of the migrated data related to dependents. Next slide, please. So we definitely understand the importance of a reliable service. We are committed to continuing to improve benefits 24/7, both the experience for subscribers and our benefit administrators. We do have a comprehensive plan to ensure that we have good stabilization of the system and able to meet the demands of the next annual open enrollment. So we have a robust testing schedule, and we will be working with our partners during this time from May through September to make sure that we're in a great place. So we have our teams actively engaged in prioritizing and addressing the reported issues. We have, as I had said, resolved a number of those issues, and we continue to move forward positively in getting those resolved. So as we move toward open enrollment this fall, our focus will remain on stabilizing the system and addressing key functional areas to ensure a smooth and seamless experience for all users. Of course, we have new functionality that we've introduced into the system. We have the vision carve out for PEB and the work around the Medicare Part D. And additionally, we're going to be reminding subscribers to register in Benefits 24/7 before open enrollment so that we can get ahead of any access issues. Certainly, we've had some reported struggles with members that are utilizing Secure Access Washington to access the system. And we just want to make sure that we have an opportunity both to get ahead of that curve with open enrollment and also allow for that streamlined access. Next slide, please. We continue to support our benefit administrators. We have outreach and training that continues to provide additional tools. They have user manuals posted, instructional videos, and certainly recorded webinars. Next slide, please. So for communications, we have subscriber newsletters that are going out both in May and October. We have a good deal of open enrollment communications with the HCA website, and we have materials that will be available at the in-person benefit fairs. Benefit administrators, we continue to provide updates for them. We provided a project update in April, and we'll continue to provide those updates throughout 2024. Next slide. Well, that concludes my presentation. Are there any questions?
Katrina, this is Dave. I just wanted to highlight again that we were all very purposeful at HCA about the launch date of Benefits 24/7. It was very purposeful to pick January. There were a lot of different months as we had looked at different launch timelines, and there's never a perfect time, but there are definitely better times than worse times. And one of our purposeful goals was to have effectively a soft launch at a less busy time of year so that there was as much time as possible to stabilize before open enrollment, well, and also before the summer when a lot of K-12 soon-to-be retirees are really getting into the system. So, you know, an IT project of this scale, there was a graphic at one point that some of you may remember, board members may remember, where we said, SEB has a car and PEB has a horse and buggy, and we're moving into a much more modern era. With this, you know, the functionality of PEB My Account prior to this was extremely limited. It was primarily for the user only during open enrollment in limited circumstances. So there was quite a lot of changes that were being made. So it was purposeful to launch in January. We had hoped that there would be some additional enhancements and improvements in the system throughout this year as we get to open enrollment. We've instead focused a lot more on stabilization and the implementation of Vision and Part D. But we have a list of things that we would love to get to one day as time permits and kind of a modular improvement throughout the years. But we will always do our best to have the development in the first half of the year and then really focus on stabilizing and making sure that the system is solid for the two busy times of the year in early summer and especially open enrollment.
Thank you, Dave. Elliot?
Yes, thank you. There's the issue with Secure Access Washington. I know that there is a link to a video that was very helpful for me, where this gentleman goes through Secure Access Washington, because frankly, personally, I've had trouble with it. And that video or whatever that guy did was very helpful. So it might be good, maybe you've already thought of this, to have a link to that for people who can't even get on to your link. Because SAW is so difficult, at least for me, to deal with without tutoring. And then probably you may have already thought of this, a link also for tutoring on a video of some kind, so that us older folks, and I don't want to limit it to older folks, but I'll just talk about me, who are terrified. And it might be helpful to have some kind of tutoring video.
Thank you, Elliot, for that. And I know this is an area that Katrina and Dave continue to really push our human-centered design teams to just keep evolving this, and I just wanna provide a huge shout out to Dave, Jean, Chatrina. You guys, I mean, you have so modernized from where we were. We were paper-based, and so this is the foray into this process. It is like everything, it's a journey. It has at times been bumpy, but you have brought us out of the dark ages. Dave, I would like to say that it's even more descriptive to say that you've taken us right from horse and buggy to at least like electric vehicle status. So, and it's not going to be without ongoing challenges. There's a reason like all our phones get tweaked and rebooted and corrected with defects every night, quietly behind the scenes. We don't have those kind of Amazon, Google, Microsoft resources, but truly, Chatrina, your leadership and how this has continued to evolve and be on top of things on behalf of the board. I want to thank you guys, and I really commend you for staying after this, because it will be, Elliot, to your point, an ongoing journey of bringing people along. So anyways, and Michaela has a comment.
Well, two questions. The first one kind of related to Elliot's question. I know that WATEC, and I feel like I should know more than this, so sorry, but I know that they're in works to transition out of SAW into another program because of all of the difficulties people are having. Do we know the timeline for that and making sure it won't happen during open enrollment?
Thank you for
We'll
that.
be sure to. Oh, sorry, go ahead.
Thank you. You know, Michaela, we're keenly aware and we work with WATEC daily. And so, you know, we too have some trepidation about any of these changes and how they ripple out and impact things. But I believe Chatrina and team and our leadership in our whole information technology division are very involved in all of this sequencing of things that happen.
And then the second question, just because it's been timely lately, when you talk about being able to use benefits 24/7 for continuation of coverage and retiree enrollment, just to like ask in the nuance, will agency heads who are departing also be able to use that if they want to access their kind of unique option for continuation of coverage?
So any PEB or sub member will be able to act, as long as they've been in the system as eligible at some point, would be able to initiate that from within the system. If they have never been in the system for some reason, I suppose then at that point, there's some very rare circumstances in which somebody wouldn't have been in the system, but otherwise 99.9% of the time that would be available from there.
And Chatrina, just to confirm this, the root of Michaela's question is people can initiate the deferral option via benefits 24/7, correct?
Yes.
Yeah, it doesn't matter what your basis is for deferral, being able to initiate deferral status can be done in benefits 24/7.
Yes, I can.
Other questions, John?
I know early on, there were a lot of folks who retired, not a lot, but quite a few folks who retired in late January, early February. And they were having difficulty getting coverage from their retiree plan as they transitioned from their employee plan. And I've been away from this for a while, but I'm curious, will all those cases resolve? Or are you not familiar with that?
Well, they're not getting to me, John, and they always get to me if there's not resolution, but we
Okay.
can certainly get back
Yeah,
on
there
that.
were just a lot of people who had retired at a certain point in January or early February. And because of the turnover into 24/7, they weren't being connected with the carriers. The carriers weren't getting the information properly or in time.
Let us look into that, John. I'm not hearing that as.
Let's go back again to late January, early February.
Right, we will get back to you on that.
Thanks.
Any other questions from the board? Again, our thanks, Chatrina, for pulling us into the modern era on this, and keep going, because we know it'll keep getting better.
Awesome. Thank you very much. Appreciate it.
All right. So wow, I have really managed to move us up in time. Look at that. We really are going fast into the future. I just am so pleased he's looking healthy on that screen. All right. I'm gonna keep moving us along because everybody likes to get time back in their day. I'd like to move us on to our next issue, which is the Liberty Mutual Auto Insurance Discount discussion. Andrea Philhauer is our fully insured team manager in the Employees and Retirees Benefit Division, and she's bringing us some information regarding the PEB Liberty Mutual Auto Discount and the criteria the agency recommends be applied when an insurer approaches the PEB program with a proposal for a new benefit. Her materials are behind tab 6. And I'm going to turn it over to you, Andrea. Welcome.
Chair Birch, and good morning, members of the board. I am Andrea Billhauer. I'm the manager of the fully insured team here in PEBB. I do, in the interest of full disclosure, need to tell you that most of the work behind what I'm about to share with you was done by John Parton, who you know, and Kimberly Gazard, who you may not know, who is the account manager who handles the Liberty Mutual account. First slide. This is a statute that requires PEB to consider proposals from insurance companies to offer property, casualty, or accident insurance for to state employees through payroll deduction. And what's important to note is that we're required to consider the proposals. We are not required to offer the proposed products or programs. It gives the board the authority to approve any such plan for payroll deduction if the insurer is licensed in the state of Washington and the board determines offering the plan is in the best interests of employees in the state. The statute requires the board to adopt criteria for evaluating these plans, and that's what we're here to start today. This presentation is intended to begin the process of adopting these evaluation criteria. We would then use them going forward to evaluate any programs the board might consider under the statute. We have some recommendations, and we're looking for your feedback on those recommendations and also any additional criteria that the board might want to suggest. And then in future board meetings, we'll bring back a resolution with proposed criteria for the board's consideration. Next slide, please. PEB currently offers one plan through this provision under an agreement with Liberty Mutual for auto insurance. And I want to be clear, we're using this contract as an example because it's the only one we currently have. We are not going to be asking you to take any action with regard to Liberty Mutual today. Actually, we're not going to be asking you to take any action at all. But we want to use this as sort of an example so that when we talk about criteria, you have a background to apply the criteria to. PEB's agreement with Liberty Mutual was implemented about 20 years ago, and it's due for review. Under this agreement, Liberty Mutual offers discounts to PEB members on their auto insurance premiums. There's one discount for being a PEB member and a second additional discount for using payroll deduction. This agreement was entered largely before widespread use of direct electronic payment, so the ability to use payroll deduction was a significant benefit. Under this agreement, Liberty Mutual sends twice-year mass solicitation letters. They're co-branded with the PEB logo as well as Liberty Mutual's. And each time these mailers go out, Dave has heart palpitations, and our PEB members contact us to express concerns about the mailers. They're concerned about the privacy of their information, and they're concerned that HCA may be selling their contact information, which of course we are not. They also express concern about HCA and the PEB board appearing to endorse a commercial product. The good news is that we've begun exploring a solution that allows us to keep the payroll deduction and PEB discounts while stopping the mailings. That is all up to Kimberly Gazard's good work. So we may have solved this one for Liberty Mutual, but we recommend studying privacy concerns anytime we're considering a proposal such as this. Slide 4, please. On this slide are some of the points we recommend considering specifically with regard to Liberty Mutual. First, there's the convenience of payroll deduction. People are much more used to paying their bills electronically today than they were 20 years ago. And this program does offer that convenience, and it's also coupled with a discount for using payroll. This is important because HCA and the state strive to be an employer of choice, making state employment appealing so we can attract and retain the best employees. We believe this convenient option has a potential positive impact on employee perceptions of the benefits offered to state PEB employees. And another consideration is that Liberty Mutual offers a second additional discount just for being a PEB member. Next slide, please. We recommend looking at the entirety of a program being offered. And in this case, the availability of payroll deduction and discounts are the entire benefit of the program. Liberty Mutual doesn't offer PEB members any additional benefits or coverage enhancements. Similarly, as you know, auto insurance premiums increase or decrease depending on numerous factors like age, gender, driving history. This agreement doesn't involve any changes to the formula Liberty Mutual used to assess a driver's risk factors. The discounts are applied to the final premium after that underwriting occurs. Those last two factors aren't necessarily positive or negative, but they are relevant to the overall benefit of the program to PEB members. Another consideration is that if we ended our contract with Liberty Mutual, our members would no longer have access to something they have access to now, these discounts or the convenience of payroll deduction. Finally, as we discussed, we recommend consideration of the members' privacy concerns. Next slide, please. So as I said at first, we're required by statute to evaluate an insurer's proposal to offer a property casualty or accident insurance plan to PEB members. And we need to adopt criteria the board will consider moving forward to evaluate any proposed programs, and that includes the existing agreement with Liberty Mutual. Now that you've seen an example of what one of these offers looks like, the next slides illustrate the criteria we suggest, and they include evaluating the benefit to our members of the proposed plan with respect to whether the product that is offered is different from what's available on the market. We want to offer our members favorable benefit designs. We also want to offer access to coverage to support equity, including expanding coverage to rural areas, allowing internet access, etc. Of course, we also recommend considering the affordability and cost of the product. Does the program offer discounts that are not otherwise available or are greater than those available generally? Does the program offer our members added convenience? Does it simplify or shorten the application process? Does it improve underwriting or approval processes? Does it provide members convenience in paying their premiums? Next slide, please. We also recommend evaluating whether the proposed program has other features that simplify members' access to a benefit. And we look at whether it will help the state recruit and retain talent. The state seeks to be an employer of choice in Washington, and offering excellent benefits is one way that we do that. Does it provide a real benefit to our members that aligns with PEB's other benefit offerings? Auto insurance makes sense as an employee benefit, but a discount on magazine subscriptions, for example, might not. Would the program be offered and managed by a reputable organization, someone PEB can be proud to be associated with? And finally, does the company offering the program use member communications about its benefits that are consistent with the types of communications HCA uses to communicate and educate our members about other voluntary optional benefits? These are our recommendations. And now I'd like to open the discussion to hear from members of the board about what we're suggesting, any criteria you have concerns or questions about, and what additional considerations you would recommend.
Thank you, Andrea, for this thoughtful walkthrough. I think, John, you're first for a question.
Yeah, I'm interested in the Privacy Act actions. When a member goes on and requests a quote on their insurance, does Liberty Mutual maintain the name of that person if they choose not to join Liberty? And does it become their information, or is it not to be used for anything else in the future?
I know half the answer to that question. The other part I'm going to have to get back to you on. I know that Liberty Mutual keeps records of the numbers of people who call for quotes. I don't know whether they record the names. I do know that what was I going to say? I just completely lost the other part of the answer I was going to give. But I do know that they keep statistics, and I'll have to check about that.
One of my concerns would be a personally identifiable information that's given on a quote.
Mhm.
Where you give social security number, you give age and so forth. And if that is all of a sudden in the free market, because I asked for a quote for Liberty Mutual, that I'd be concerned with their policy, with our policy, and so forth, to make sure it aligns up so that we don't find ourselves in a lawsuit at some point.
Thank you for that comment and question. I know, Andrea, you're trying
I just
to.
wanted to add that Andrea will also need to tease out for you, John. It may depend on how the individual begins the engagement with Liberty Mutual. If they go on the public website and start to get a quote and they happen to be a PEB member, that's different than if the data came over from the healthcare authority and that was a solicitation that went out to the member. So there may be a different answer based on how somebody entered or began the engagement with Liberty Mutual. I can highlight for you, though, that the marketing solicitations of past from Liberty Mutual on this with members did have an opt-out option. And at a point that an individual said, I don't want these solicitations, then Liberty Mutual refrained from future solicitations based on that opt-out. So just another little piece there.
Thank you for that, Dave. I do want to let the board know and the general public that Tom McRoberts has joined us. Kurt, you are next in the queue. Go ahead.
Oh, thank you. So definitely support whatever we can do to make the state of Washington a better employer of choice. Obviously, in our opinion, it's becoming harder for the state of Washington or really any public employment to retain and recruit public employees. That being said, do we know the number of PEB members that participate in this program?
We do, and I believe that Kimberly is online with us. So what I'm gonna ask her to do is to find those numbers and shoot them to me if she can. If I do get that message, I will let you know during this meeting. But I will be back with you to talk about to talk about a resolution in the future. So if I don't get that information for you during this meeting, I will definitely have it for you next time.
Thank you, Andrea. Sharon, you're next, and then Kayla.
Thank you so much for this presentation. I think the question that I have is around recruitment and retention, particularly the retention piece and the consideration that's given to that. Of course, retention involves tracking, and then this is where the issue of privacy comes in. So I kind of wanted to kind of follow up with you in terms of whether that's been teased out, their retention.
So let me make sure I'm understanding your question. You're asking about people retaining the Liberty Mutual policy?
Yes, employee retention of the policy and how that will proceed without there being any breach in the privacy piece because tracking.
I do believe that we have the answer to that question. I don't have it at my fingertips, but I will bring it back.
Kayla, and then Harry.
Sorry, a couple of things. If like with regards to kind of additional things to consider, there's a way to opt out of paper altogether, just in general, like banks offer and stuff, that would be great. And then kind of clarity on around the ethics compliance of like what you can use on state resources, especially if this does turn into something that's online. From like an ease or convenience perspective, I know for a lot of state employees, that's a difficult thing to navigate. And then kind of, I know working with John and Dave, sorry, I know every time I come back from a conference, I'm constantly contacting you all. As we're looking at, like I'm looking at the RCW, and if there's a way to kind of expand the wording so it's not tied to just property or accident casualty insurance, and just thinking about other insurance benefits that employers want to be able to provide discounts to employees for. Just off the top of my head, a couple of things that have been coming up from other employers is around kind of supplemental behavioral health, child elder care access, and same-day pay. And those, I know there are a lot more that are popping up that employees want to be able to use and they don't have access to, that we can't necessarily afford to purchase for, but if we can get a discount and the convenience of payroll deduction, it would be great as an employer of choice to be able to offer those.
And that's really important to put onto our wish list every year when we look at what other benefits should we be re-exploring. So just remember to keep pulling those over, and as we evolve this criteria, make decisions, I think more of that's going to come into play. Harry, you were next, and then I think Elliot.
Okay, thanks.
Real quick, Sue, I would like to give Michaela a little bit of an answer on her last question. It's interesting that you bring it up. PEB Board has authority for about 10 additional benefits that are different than the PEB statute. It's an area of potential legislative action in the future. Things like pet insurance, travel insurance, identity theft protection. So it's a potential way to there'd be a relatively straightforward way to amend that statute to make it apply to both programs. And so if people are interested in what that list of potential benefits is that already exist in statute, at least for the sub program, it's RCW 4105.745. So that's 4105.745.
Thank you, Dave.
And we, I would be happy to partner with you on that.
Thanks, Kyla. Harry.
Okay, thank you. I had two things I wanted to ask about. One is Liberty specific, and the second was, I don't know if it's a question, it's just an observation, comment from 2 years of experience. Does Liberty provide any data regarding real savings? I mean, is it tracked somehow? That would be part A, and part B is if there's a coverage complaint. I talk to people that are really trouble with their auto carriers this year, but it doesn't matter what the insurance company is, they've gone up 20%. So if I'm sitting home with my Liberty Mutual and enroll through the state and I'm not happy about the 20%, who do I call? I call Liberty, and they say, well, that's the way it is. And beyond that, if I'm not happy with that answer, you know, do you guys get the calls? That, if you could talk me through that, then I'll ask the second part. Thanks.
So your first question was about the real numbers of how much our PEB members have saved through these discounts. We do have those numbers, and I will get those for you. And just to track back a little bit before I answer the second question, Kimberly says there are 2,251 policies currently on payroll deduction in the state. So the second part of your question was what happens when there's a complaint and someone contacts Liberty Mutual, is not satisfied with what happens, and then contacts HCA, is that right? What would happen in that case is that complaint would go to Kimberly, who is the account manager. She would then contact Liberty Mutual directly and say, basically, explain yourself and fix this. That tends to be very effective. We sometimes have that happen. You know, that's the way it happens with all of our accounts. We have really good relationships with our account managers at our vendors. And so it's helpful for folks to be able to contact us and get that direct, you know, on the phone in real time conversation happening on their behalf. So that's what would happen if someone contacted us about a complaint that they couldn't get resolved through the company.
Okay, thank you. If I can just stand on the corner here briefly. Typically, in my experience, has been the employer goes out with an RFI, and typically that's the way we're used to working, you know, and gets information, kind of leads that process. This is kind of flipped my way of thinking. So that is something that has to be thought through. And secondly, this is goes back to years ago when I worked part of a state association with some other states in the Midwest that we would get together and talk about common problems. I'll never forget one of our brethren, if I could use that term, talked about from their place, which had a much more political term, liberal way to be being offered in their state. And this place, primary reason for this other state was to provide health insurance, dental, all that kind of things that we do primarily. They told us in this meeting they had for other offerings beyond the core stuff. So this is old man on a corner. I don't want us to get into that stuff. I mean, I hear pet insurance, all these other things, which I think are great, but you know, if we're not careful with this, we'll be going in asking for FTE to manage all these other programs that have minimal and move us away from the core business. I'll get off the corner. Thanks.
Harry, thank you. But we call that mission creep sometimes, and I think it's well stated, and it's something I think staff, as they put together this criteria, and this comes back to us for future action. It's something we really have to take seriously. Elliot, you had a question or a comment?
Very quick question. Does this apply to retired state employees, this insurance?
Does not.
That's interesting because I received a solicitation from Liberty Mutual.
You know what? That probably means I'm wrong. I
know that.
I should have said I don't know, and I'll find out.
No, we don't know why they sent it. There could be many reasons. But from what you're saying, it doesn't sound like it.
Well,
I'll find out for sure and get you the correct answer.
and I'll remind you, Elliot, since we still are in a data conversion, because you were a state employee, we heard earlier from Katrina about the
Good
old
point.
outdated data. So we are, as this agency has been modernizing kind of our
Good point.
registers and whatnot, it's amazing what we are finding.
But I retired in 2015.
Who knows, but we can that's certainly an
I voted, I got-
interesting.
And he never
Just
retired.
got one in the mail. I do it all the time. It doesn't, you don't know where it comes from.
Or
I
for
would
our,
assume it came.
When
from
you're
state.
older, you think, oh, am I in this program? And I don't want to say everyone older is as confused as I am. I'm not saying that, but it was confusing.
thank you for that. Andrea, my question is about the reputable organization. I just think the board is gonna have to have further discussion too. I mean, is this gonna mean we are gonna be looking at, or how are we going to define reputable organization? How are we gonna stay on top of what they're investing in or what they're doing? And so I just would ask, when staff come back with that criteria, that we flesh that out, because that's becoming increasingly difficult to do in today's world. So, but I really appreciate the beginning work that you all have put together on this evaluation criteria. I too echo a little bit of Harry's concern about mission creep and how far we go. I do think that as PEB and SEB, I think with the alignment or potential for consolidation someday, we have to continue to look at those, that alignment. So thank you for this information.
I wanted to just address Harry's question a little bit further. And also I wanted to let Elliot know that what we have is, the program does apply to retirees, but payroll deduction obviously would not be available to retirees. The payroll deduction discount is 7.5%. And the PEB affinity discount, they call it, the discount for being a member of PEB is 10%. So that 10% would be available, the 7.5% for payroll deduction would not. We do have, there are two tracks for benefits to be offered through PEB. The first one is the one that you mentioned, Harry, the RFIs and RFPs, request for proposals, where we go out and we solicit benefits. That is kind of a separate track from what this statute is talking about. This statute is really asking us to, when insurers bring benefits to us, like Liberty Mutual did, we need to have a standard set of criteria that we use to evaluate those programs, which is why since we need to do that this time with Liberty Mutual, we're not going to do it until we have that standardized set of criteria. So it's kind of two different paths to get to the same place.
Thank you.
So Andrew, what do you think the time frame will be that this will come back to the board?
I believe it's scheduled for next board meeting. I'm looking at you, Dave.
We are, consider this part one of a 3-part mini series, if you will. Anticipate that the next 2 successive board meetings will have additional conversation and potentially a resolution for consideration. And if it needs additional baking, it needs additional baking. But this was at least part one of a 3-part miniseries.
Streaming on Netflix.
Yes.
Just a
Limited
joke,
series.
a little humor there.
You know, and I'll also add to Harry's point, it is counterintuitive to many people that the PEB program has an auto discount benefit within it. It is very different than what Harry said, where the core benefits, medical, dental, life insurance, LTD, vision, because all of those are actual group policies where the claims experience of our population is pooled together, and the risk of that pool drives the rate that everyone pays. This is not that. The property and home insurance is individually underrated based on that person's demographics, their driving experience. If it's their home, it's the size and scope of the land, it's where it falls, and floodplain. There are all these individual factors, and then there is this group discount that's given, but it's not a group policy. So it is very fundamentally different than the other parts of the benefit, which is why so many people don't even realize that it exists. And that's when the letters historically that have been sent, one is in your appendix, you look at it and you read it, and it's like, this is it very much looks like a very clear endorsement of an individual policy. And Andrea's right. Every time the letters have gone out in the past, it's like clockwork. You can expect at least a dozen concerns about privacy that are brought to the agency every time those letters were going out. So really appreciate Liberty's partnership in kind of suspending those letters as we continue to look at this area, helping us understand the real value of the payroll deduction that, also feels like it's from another time and place in many ways, because we have direct bank transfers at this point, but that wasn't, a thing in the 90s. And this statute is part of the original enactment of the PEB Board Authority statute. So it was crafted in 1988. So, there's lots of things to look at in the historical lens here, but it is a very different type of benefit that sits within the portfolio.
I think, Kyla, and then Harry, it looks like you have a response.
Thanks.
Yeah, and I'll just add, for what it's worth, and I completely understand scope creep because my team is very much there as well. I think it's just, and it's one of those wicked problems. So not saying there's a solution, but just to be thinking about historically when we're talking about, Kurt, you had mentioned recruitment and retention challenges of state employees, and historically our benefits have been one of the big things that we've been able to say, like, this is better than anywhere else you're gonna get. And looking at other employers, like, that is slowly going away. We are not nearly as competitive when it comes to benefits. So I think it's acknowledging that there is scope creep, but also if we want to be able to keep up with what other employers are doing, especially knowing that we can't always keep up with salaries, the more that we can provide people with either supplemental benefits or discounts to things that they are going to be spending money on anyway. I know, like with the military, that's a lot of it is like, hey, like, you might not make a big salary, but here's all the places where you get to spend less than the average person because of those discounts. So it's just trying to think about, and not saying it's all healthcare authorities' responsibility, but just continually trying to think about, for our employees and retirees, what can we do to make us competitive, to show that there is a benefit to being a public servant.
Harry?
Yeah, thanks. That's a really good information. Just a question regarding, not necessarily liberty, but if this is out and sort of in the open being discussed now, Safeco comes knocking on the door tomorrow and says, hey, I would like to be considered. What do we do then?
We would apply the criteria that you all are gonna vote on in a few meetings. And we would look at that offer, then we would bring it back to the board and, would the board need to
So
vote on
is the board then going to vote on the liberty thing? Is that what we're hearing? Is there going to be a resolution that, yeah, is that an endorsement or is that,
I believe that what the board needs to do is to create those criteria. And then we would then apply the criteria that you all have given us to offers.
Yeah, that's correct, Andrea. Is because we identified a gap in existing policies and procedures on this area, we wanted to develop those criteria. If somebody literally came this afternoon, we'd say, okay, we're going to consider that as we are developing these criteria, and we'll apply the criteria after they're made. And there's not any timeline in the statute. I'm sure there needs to be some reasonable amount, but we would, since we're on this journey of developing this criteria, it would be put in a holding pattern until this criteria is at least developed.
Thank you both for that clarification. John?
Yeah, Kyla brought up a great point, and that is our mission. The Healthcare Authority is the host to Public Employees Benefit Board. Public Employees Benefit Board could be a whole scale of benefits that are related to healthcare. Same thing with school employees benefits. So I think this is probably a more fundamental discussion at some point, maybe next year's retreat. We talk a little bit more about, does PEB want to go in that direction of non-healthcare related benefits? Or do we want to stay in the lane of healthcare related benefits and possibly have another department take over some of the non-health related benefits? Just a thought from probably a 10,000 mile elevation.
Thank you for that. Sharon?
I really think this is really in the realm of health, because when we think about safety in a holistic way, this is what this is about. It's extending that conversation about safety, whether it's driving, whether it's your home, whether it's, David mentioned so many other different things that can happen, whether it's weather-related floods or what have you, that's about safety. And so I do think that this is quite relevant. And to Mikhail's point, I certainly won't say anything. He said it so well. This is certainly a very important domain to be moving in.
Thank you for that, Sharon. I would point out, as a member of the Washington Traffic Fatality Safety Commission, I mean, I will tell you, vehicular deaths are at an all-time high. There are increasing numbers of people that are uninsured. So your point, and I think we are dealing with this catch-up, John, of, historically, we thought of health being related to healthcare. And we now know, over the decades, we've come to accept all of these other social determinants of health. How far does this board go? Do we start getting into nutritional supplementation? We already have some nutrition benefits, but how far do we go? It was to my comment about mission creep.
Yep.
This is not, we're not the only board being impacted by this. All sorts of folks are trying to figure out how far do they go on eligibility analysis of, people living in environmentally dangerous zones versus in safe neighborhoods or environmentally safe neighborhoods. So more to come. I really appreciate the framework and the shaping of this conversation. I know we will stay in partnership with our labor partners and state HR, and I look forward to how this comes back to the full board. Harry?
Yeah, I want to add one more comment, and this isn't related to liberty or anything, but I hear this comment a lot, and I used to think I knew the answer, but I don't anymore. Which is, we have to offer benefits, programs, whatever, consistent with the competition. We can't compete in salaries, perhaps, so we have to offer this. And so I guess I'm wondering, I haven't done any research lately, is what are those benefits that are most important to employees? I don't know. I know health insurance is. I know dental insurance is. Life insurance, here, AD&D, some of the things that I didn't used to think when I was in your role, that maybe Michaela's was, we didn't consider them, but now we do. And so it's a new world, and for me especially. And so I would be interested if anybody in there at some point in the future wants to share with me 5 minutes or so, what have they learned that we as a state are really behind on? The fact that we don't offer pet insurance, is that really important? And I'm not being I don't mean to sound disrespectful, but all those things, do they provide a benefit that is worthwhile, that it keeps, does it really have something to do with us being competitive in the marketplace?
Harry, you express kind of the billion-dollar question in the arena of social determinants of health. I mean, if we delivered perfect healthcare, we'd still only be impacting 10 to 20% of a person's health, overall health. And we don't have the answer. We know livable wage households that's enormous impact. And so, like the military, providing all these other benefits that help people get towards more a livable wage household, huge implications, but is that transportation? Is that housing? Is that food? Is that those safe neighborhoods, physically safe, environmentally safe, all socioeconomic, how we don't have those answers, but there's a lot of exploration going on in this area as to our retreat topic last year on population health or social determinants of health, or what people now are terming the health-related social needs. So this board will continue to mix this into the conversation, but we definitely have kind of some more guidance as the PEBB board has got movement in these other areas. So this will be an ongoing conversation. We don't know as a society, and we are also, quite frankly, studying a lot of the European or OECD nations too, of what is in their offerings. And we also know there's a very capitalistic framework on top of this as well. So lots more to come on this conversation. We are not resolved. Andrea, I really appreciate that you stirred this beginning conversations, and I can assure you this will be coming back, especially in a labor bargaining year. I know many more conversations are being mixed in there. And we will probably have to go back to the legislature too with some refinements as we make some decisions or recommendations about our future. Dave, do you want to add anything else? And then Elliot will let you have the closing comments.
Yeah, I can absolutely share anecdotally, but in the last 5 years, if you look at insurance lines, there is a very clear singular insurance product that gets asked for more than any other insurance product from both employers and employees that advocate to me or to the team, and that is absolutely pet insurance. So at first, the very first time somebody brought up pet insurance, I was like, really? And I will tell you over the last 5 years that it is unquestionably the #1 insurance line product that comes up as is there ever anything that can be done in this area? It was actually one of the two motivating pieces that resulted in the legislation that has a list of 10 benefits that school districts are allowed to independently offer unless and until the PEB board consolidates and creates a product. It was cancer insurance and pet insurance, and then a list of 8 benefits were additional benefits were kind of crafted into that authority. So pet insurance is something that many people are extraordinarily interested in. And then, as in the past couple of years, there's also been a movement that I think I'm not sure if it was this last session or the session before, but there was a pet insurance bill that passed the legislature giving regulatory authority to that area to the insurance commissioner's office as well. So that part of the industry is really getting much more of a regulatory framework around it, and really is, I think, likely to blossom the type of offerings that can exist in that area. So I would not be surprised if there were ever an additional line beyond the medical, dental, vision, life insurance, AD&D, FSA, DCAP. We have a list of 8 to 10 things already. I wouldn't be surprised at all if the next one that ever ended up on the list, if there is an addition, being pet insurance.
Can I just add?
You bet. Go ahead, Sharon.
One thing that I do want to be mindful of as we increase our use of technology, what are the implications of that? We talk about social determinants of health, but that's getting much more broad than the traditional social determinants of health, whether it's food security and housing, what have you. And, I know we're using technology to address one particular social determinant of health, which is social isolation, but technology brings its own concerns, right? And so as we become much more engaged in using this, we have to be able to think about some of the negative implications, but particularly for younger audience. And so I think that the board, there's room there to see how, yes, we are moving forward to some degree with technology, but how can we mitigate the negative implications of excessive use of this, certainly within our younger population. And I think that is something that we really should take on very, very seriously, because that is becoming more and more of an issue.
It's funny that you bring that up. I spoke with somebody yesterday whose family is offering their 12-year-old $3,000 if they don't use social media till high school graduation. And somebody looked at me and said, "Can you insure for that?" And I was like, "Oh God, here we go. Social media insurance." I just was like, "Oh God." Yeah, anyways, there's so much more coming on this topic. Elliot, you get the final comment, and then we're going to turn to public comment.
I have a request. Is there any way to cost out what it would cost I represented the veterinary board and we were covered by the Department of Health. And so animal health was just as important as dental health, mental health at the Department of Health. So I'm biased, okay? But is there any way to cost out what it would be to provide pet insurance and the kind of insurance, I can't even explain what you just said, but it sounds good. So is there any way to say, look, like Dave would say, this is the attractiveness of pet insurance. This is the rate creep. This is, I mean, the mission creep. This is the cost. And to compare the two so that we have some data. And I think this connects to what John said. I don't think this is something you can do by the next meeting. But I think we need data, like Harry would say. What is the downside of each of these? These are really important questions. And I think we need data to assess it.
So I want to clarify, Elliot, we will not be taking action next board meeting. We're beginning the ongoing conversation in this arena. There'll be public comments, I'm sure. We'll have staff be refining criteria, bringing us data. There'll be a lot more work done in this area to see if we're going to make recommendations to the legislature for some changing or reshaping. This is just a beginning place, and absolutely, I hear Andrea and Dave assuring us that they'll be bringing back further things to consider. Dave is very involved on the national scene at the public forum roundtable. Dave, I'm getting the name wrong, but
Public
so
Sector Health Roundtable.
yeah, so I know he's also mixing in kind of the best and brightest from other large public insurers, and just this is an ongoing area of evolution. I know the White House put out guidelines in November about health-related social needs, and so that's also playing into this because this is so far sweeping. To Sharon's point, you know, pet insurance is just one component. There's so many other components of what the potential offerings could be. And Michaela, I know you're steep in this because, you know, are we going to get into some of the things that people ask us about? Like, can we get a ghost insurance? Can we get, I mean, there's just all sorts of things that frequently come up of like, oh, that's interesting. Never thought of that. We will get more criteria, we'll get more shaping. Staff will bring this back. It will not be on Netflix, but as Dave said, this is going to be one of a series of discussions that we continue to evolve and hold. So lots more education, and definitely we're going to create a placeholder on our strategic planning session, Dave, for the future, because this, again, you know, with what we're learning about neurocognitive states and the science behind everything, this is just an evolving area that we are trying as a country to get more fine-tuned on. All right. Andrea, thank you. I know that was a very broad sweeping kind of conversation that gives you more to go back to. And anyways, I would suggest that we take a 5-minute stand break and then come back for public comment stand, goodies, coffee, restrooms, bio breaks. And we will be back here at 10:34 for our public comment period. So members of the public, we are just going to take a quick break. Unexpected, sorry, staff. So this is the time that we open up our lines to take public comment. And we have this in each of our meetings. Is there anyone on Zoom that would like to provide comments? And I notice on site that there is no one signed up or raising their hands or approaching the table. Mackenzie, do we have any public comments? Yes. So if you would assist me, I want to remind speakers from the public that we'd like you to get to give us your name, your affiliation, and Mackenzie will queue you up and signal to me. I also ask that you keep your comments to about 3 minutes. And yeah, let's go ahead and begin.
We have 4 public commenters. The first one is Fred Yancey.
Fred, I believe you are our first public commenter. If you'll go ahead and identify yourself and your affiliation and make your comment to the board, please.
Good morning. This is Fred Yancey on behalf of Washington State School retirees. My question, and I will say I sent to David and to Andrea and Ms. Philhauer these questions as well, but I'm just concerned about the Liberty Mutual auto insurance discussion, really the discussion about alternative products that offered through the PEB program. And my question's really concern is how do retirees fit into this program in terms of, payroll deduction, in terms of do they need to be a health subscriber in order to access these programs, or can you access them without having health insurance? And anyway, I've sent some questions in regarding that. So and I certainly understand the issue of mission creep. It certainly is a great discussion, and I'm glad that the board is going to continue discussing that. But my concerns really are just how do retirees fit? Do they get a deduction? They don't have a payroll deduction, although they do they pay their premiums through their DRS checks. So does that entitle them to a deduction, or is that an additional criteria to offer in the future? That's all I have to say, and hopefully I'll get answers to my questions and they were clear enough. So thank you again for your time.
Thank you, Fred. You know you won't get that answer today, but I see the board members are shaking their heads like this absolutely be part of our ongoing discussions and the criteria that evolve and any necessary steps we might have to take with our authorizing environment. So thank you for that input, Fred.
Will we be able to see the answer given to Fred so that?
Of course, Elliot, we always remember we talk about things 3 and 4 times before we take action, and we always present all of our information publicly. So just a reminder that all of our work is done transparently and shared publicly. And Andrea, I'm certain she and Dave and Jean will be bringing back kind of more shaping of this issue so the board can keep evolving the conversation.
Thank you.
All right, Mackenzie, who's next for our public commenters? Is it Amy Fortier? Amy, if you'll identify yourself and your affiliation and make your comments before the board. Thank you for being with us today.
Good morning, Chair Birch and members of the board. I just wanted to say thank you for fortifying the Uniform Medical Plan with the resolutions you voted on today. Those seem important, and a number of people are affected by those, and hopefully this will be a more detailed benefit for their use and hopeful for their own health management. I wanted to address the use of criteria and evaluation. I know that human-centered design does have some parameters for selection, ongoing evaluation, renewals, some of those kinds of things, and perhaps that's an area to look into more diligently in coming up with criteria that's somewhat more detailed and also allows for ongoing process improvement. Another element would be subscriber feedback to develop both criteria and evaluation, and something like support groups, needs assessments. Someone mentioned that not everyone responds to surveys. Just some different ways where people can provide the feedback that's going to be needed in further discussions. I have read that there are states that are canceling home insurance policies, for example. So in that wider conversation and dialogue that perhaps this will end up leading to overall, how do we make judgments to decide what additional insurances are added, how they are added, how they are evaluated, are they successful, are features and benefits going to work, and if so, how, and who do they Who do they benefit and what is that cost? So just some feedback, a lot of philosophical questions I think came up today, including the social determination conversation. So I applaud you for taking the time that's needed to make some thoroughly detailed evaluation and criteria feedback as time goes on. Thank you.
Thank you for those comments, Amy. And as you know, we began some of these conversations in prior strategic board retreats, and the conversations will continue as the science and as we continue to have answers. I do want you all to know that our agency took a key leadership role between the University of Washington School of Business, the Evans School, I believe, and many other state agencies around human-centered design and what we call the CXI initiative. And so everything we're doing around surveying and modernizing technology solutions has kind of so much more of a consumer focus. I don't know which staff member from ERB is involved in this. It's a certificate program for government employees to really get their heads wrapped around this notion of the proper research evaluation, focus on human-centered design. So more to come on this issue. I think you're planting the seed for one of our board retreat topics of the future.
You read my mind.
It was already on the list, Elliot, but anyways, thank you, Amy, for those public comments. Mackenzie, who's next, please? Okay, Erica, if you will, we're bringing her up on the screen. Okay, Erica Sahota, you are our next public commenter. If you'll identify yourself, your affiliation, and where the board is listening, go ahead.
Sure. Hello, and thank you for your time today. My name is Erica Sahota, and I'm a public employee at the University of Washington, and I'm here today to emphasize the necessity of making infertility treatment a covered benefit in the public employee benefit plan designs. I understand there's a lot of budgetary and bureaucratic hurdles to making this a reality, and I understand I'm certainly not the first public employee to suffer because of this lack of coverage, but I hope by sharing my story today that I can bring more awareness and understanding to what an urgent matter this really is. So in February 2023, my husband and I began what we thought would be a rather standard journey to becoming parents, as most conventionally healthy 30-somethings would assume it would be. We ran into issues when 6 months in, we decided to get testing as a precaution and discovered that we had a male factor issue. Over the next 6 months, we would attempt to fix the issues through lifestyle changes, but as with most infertility, it turns out the issue is not in my husband's control and cannot be fixed by lifestyle changes. After a full year, our doctors recommended IVF as the next best course of action, and we both did the diagnostic testing and genetic carrier screening that is considered standard protocol prior to starting IVF. That testing revealed that I'm a carrier of a rare sex chromosome-linked condition called alpha thalassemia X-linked intellectual disability that will affect 50% of my embryos we create by either making them silent carriers like myself or affecting their health and lifespan. People affected by this condition often never talk or live independently and have shortened lifespans. No one in my immediate family is a carrier or affected by this condition. And as doctors have told me, this is just a random unlucky genetic mutation that started before I was even a living, breathing human and just a cluster of cells. Throughout these discoveries, we were both aware that neither of our insurance plans would cover any fertility treatment, as my husband's private company's insurance plan, as well as mine, both maintained any fertility treatments as exclusions. However, after my diagnosis with this genetic condition, I read through my insurance plan literature at length and was able to find a pre-authorization that covered only the biopsying of my embryos for pre-implantation genetic testing, but no part of the creation of those embryos is covered whatsoever. By insurance's somewhat abstract medical definitions, having my embryos biopsied and tested before implantation is medically necessary, but creating them at all is not, and therefore entirely excluded. I hope what you can take away from my story today is that people who struggle with infertility have no control over their circumstances and just get unlucky. It has nothing to do with how healthy they are, how hard they work, how much they try, how many doctors they meet with, how much research they do, or what led them to becoming parents, wanting to become parents in the first place. There are public employees right now teaching your children, staffing our universities, helping our governments run. Maybe people in this room right now who cannot afford to have children. because they simply got unlucky and insurance doesn't cover their situation. Please prioritize adding this to the plan design for all public employees. Thanks for your time.
Erica, thank you for your comments, and we hear you, we acknowledge your comments, and I'm sure the board, that this will continue to be an ongoing component of our offerings and our benefit design in the future. But thank you for your heartfelt words. Dave, did you have an update?
Erica, I'm really glad that you came to a board meeting. Erica reached out to me, I think it was in March, and she and I had a conversation about how benefits are developed and the history, the long history of evaluation of infertility benefits in our state. And I really encouraged her to come to the board because it is personal stories like this that are hard to share, but important to share to keep the pressure on and keep our collective awareness of the challenges that people have. So I just really appreciate you, the vulnerability you've had today and sharing with us and continuing to move this conversation forward. I do want to make sure that the board is aware that the legislature in recent years has inched closer and closer and closer to authorizing some sort of fertility benefit. There were significant hopes that there might have been a bill that passed in the session that was that just ended, and there's more momentum than there has ever been on a fertility benefit in our state. So there is a potential ray of hope at the end of that journey, but I just wanted to thank you, Erica, for sharing with me privately and then coming to the board and sharing. I know that can be very hard for people.
Yeah, and I just want to say thank you to employees like Dave. And I joined a little early because I didn't want to miss it, but I just overheard a lot of really, really good conversation, not about infertility, obviously, but I can tell this is, a group of people who really care about bringing insurance benefits, that really matter to people. And so I just wanted to share that today. And thank you, Dave, publicly for just taking the time to meet with me and explaining the process. And I'm very encouraged by what I'm seeing, in the legislature. And so, yeah, thank you for your time today.
Okay, thank you, Erica. Mackenzie, who is next in our public comment queue?
Don't have anybody else in the hand up.
All right, I'm going to make one more call for anybody in, it's all staff here, and nobody in the room, anybody else online that would like to comment to the board today. We are not seeing any hands go up, and if you can't find that hand signal, I invite you to just jump in audibly, although we would have to open that line. So I think we are done with our public comment period. I'm going to go ahead and close that up. All right, board members, we have a few announcements to make as we close out this meeting, but I remind you we're going to be transitioning into executive session, so don't be leaving us if you're on virtually. So we have now concluded the May board meeting. I know it's early, but that's always great. We love to give time back. Our next board meeting will occur June 13th with the same format of attendance in person or via Zoom. For those of you that know me, I'm sorry to keep saying this, but I have my oldest getting married, so I will not be joining you in June. I will be staging for a wedding and Lou will be filling in for me. You can participate here, as I said, in person or via Zoom. I will be thinking of you from afar as I move into my journey with thinking about you. Dave, are there any final comments before we head over into our executive session?
First of all, there is such a thing as wedding insurance policies, just for the record. That is not on the list in the sub statute, but I did want to say that when I learned that is an insurance product, I kind of forgot until you just mentioned that, Sue. So just know that there is wedding insurance out there. It's a significant investment in people's lives, and people tend to try to insure those things. For the June meeting, there are a couple of topics that we know. We're going to have Ellen come back. I mean, we had a whole meeting without Ellen, but she's going to talk about where we are on our Medicare implementation journey. We're gonna have Jenny Switzer come back. There are some questions that have come up this board season to help people understand the relationship of MODA and UMP and ArrayRx and who's a PBM and who's, you know, the various roles and relationships of subcontractors and the various words that exist in the pharmacy administrative area. So we've been working on something on that front. And then Andrea will be back with, I'm gonna coin it, the additional benefits questions, you know, insurance type questions. So we have those things as well as an important executive session. To this executive session, we're going to be talking about Medicare rates and where we are in the rate development process. We'll continue that conversation at the June executive session, but then we'll also begin talking about the non-Medicare rates. We are kicking off rate setting processes with the board, so to speak, in just a few minutes. So back to you, Sue.
Great. So we're going to transition to that executive session, and it's going to happen here in this Sue Crystal room for board members and the included HCA employees. At this time, I would ask members of the public joining us in person, which we don't have any, as well as employees not part of the executive session, to kindly leave the room. And you'll be out in the lobby for the duration of the executive session. You will be called back to join us in Sue Crystal for the remainder of the public meeting, which is intended only as a very brief statement to formally adjourn the meeting. And after the executive session that'll happen after the executive session has concluded. So it's always so hard for me as the nurse. Let me read this legal statement. Pursuant to RCW 42.30.1101L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchased healthcare services as provided in RCW 41.05.026. The executive session will conclude no later than 1 p.m. Board members, we're going to take a quick break while we transition into our executive session. You know, we got to do some technology twists, and we'll return to our public meeting to adjourn after the executive session. So again, members of the public, we are going into executive session. This is Stu Birch. I am returning our board back into our public meeting. We have just finished an executive session. I want to thank members of the public that listened in today. And I want to thank the board members, especially those of you that traveled from far, for joining us. We, at this point, are adjourning the meeting, and let the record note that it is 12:53. This meeting is adjourned.
Anytime.